Thank you, Mr. Chairman, and Senator Stabenow for holding this really important hearing today. I have many issues in the Senate, but this is an issue that is extremely personal to me. Since my late mother suffered from Alzheimer's for 18 long, difficult years. Years when we watched her drift further and further away. And she was a courageous woman, a woman who saw her country in the midst of revolution and decided, against my father's wishes at the time, to uproot her family and come to the United States in search of freedom and a better life for her children, which at that time meant my brother and sister. Coming to a country where she had no one waiting for her, didn't know the language, and had no real understanding of what the risk she was taking. Courageous woman. And so when it first happened, I, of course, hoped for the best, but, of course, expected the worst. And there were days at the beginning when my mother seemed just fine, when the lost moments became more pronounced, and when they began to last longer. Now, there were times I wondered if she would recognize me the next time I walked into the room. And I wondered if all the memories of my youth and her life were in there somewhere, or whether they were lost forever. And for a while, it seemed she was as she was before, but then, as you know, it gets worse. So she lost her cognitive powers, and then the time came when I realized she was really no longer with us. And then, mercifully, the long goodbye came to an end. Now, the grand irony of it all is that often the toll Alzheimer's takes on the family, on loved ones, and on caregivers can be worse even than the person suffering the disease. I think about it in the case, and I appreciate Ms. Karasoff's personal testimony. I appreciate her willingness to share it with us. I think about it in the case of my own sister. Her name is Caridad, which in Spanish means charity. And she had an enormous amount of charity to give. A legal secretary who during the day worked as I paid for a home health care aide because of our cultural belief that you just don't put mom in a nursing home. And then would come back at the end of a long day, no vacations, no time off. And the only time she had off is the time that I could ultimately come and give to her. And I think about the intergenerational challenges that we have with this disease, trying to give mom the dignity she deserves in the twilight of her life, taking care of the education of our children, trying to get them through college, and thinking about our own lives in the future. And I think of how many families across this country face that intergenerational challenge as a result of this disease. So that's why I believe that we must ensure that in addition to proper diagnosis, treatments, and eventually a cure, we have to support and care and give planning support and care to help families prepare for life with Alzheimer's. And I think Congress needs to aggressively fund the research for causes and cures, because if not, the long goodbye will be even longer for the nation in cost and in heartache. So that's why I'm a proud co-sponsor of Senator Stabenow's Hope for Alzheimer's Act, because I think it expressly provides for these planning services. And I'm pleased to see that CMS has recently announced new billing codes to allow physicians to provide care planning to Medicare beneficiaries. I think that's incredibly important. But one of the statistics that was mentioned in testimony today is that fully 2/3 of those with Alzheimer's disease don't know it. And to me, that's a tragedy and a failure of our healthcare system. It's not only a failure to properly treat people, but it causes an undue and unnecessary burden on the healthcare system, which is a good part of what this committee focuses on, certainly the human part of this particular disease, as with other diseases that we face, but the cost to the nation collectively. And since we know that early diagnosis leads to better long-term outcomes, which in turn lead to lower costs, it seems to me that any investment that we make in providing physicians with the time, with the resources, with the knowledge they need to better care for those with Alzheimer's will ultimately pay for itself many times over. So I want to follow up the one question I have to both Dr. Paulson and Dr. Peterson. I heard part of your response to Senator Stabenow, but from the perspective of a clinician, what is the root cause of this underdiagnosis? Is it simply that you say that doctors don't want to necessarily share a very difficult diagnosis with patients? There are many diseases, some of which are horrible, like certain forms of cancer, which I assume a doctor would not want to give that diagnosis, but nonetheless do, even though the results at the end of the day may not be what that family hopes for. Is it that there's not one definitive test for Alzheimer's which can account for this major lack of timely diagnosis? Is it simply because of a lack of time and resources, which of course the HOPE Act and CMS's new benefit would help address, or is it a larger misunderstanding and lack of knowledge about the disease more generally beyond specialists like yourselves?
It's an excellent question, Senator Menendez.
I only ask excellent questions, so. Okay. I'm just kidding.
I'm sorry.
Just kidding.
I wish I could give an excellent answer.
I always ask excellent questions, I can tell you that. But.
And it's very important. I think many of the issues you mentioned are all playing a part. I think there is, on the physician training part, how comfortable they are with making the diagnosis, because it's not a simple blood test. It's not a simple X-ray. It is a clinical judgment, but I think with some of the new techniques we have now, we can be more confident that, in fact, this person who meets the clinical syndrome of, say, dementia now has Alzheimer's disease as the underlying cause. So I think we're getting there, and I think the IDEA study that Connie mentioned is going to help us to convince CMS that, in fact, we should support the amyloid imaging component of the diagnostic process. So I think that's part of it. I think there still is some therapeutic nihilism. There's nothing we can do about this disease. Why burden this patient with this kind of knowledge? And as Dr. Paulson has indicated, there are many things we can do about it. But most of all, the patient and the family deserve to know what's going on. It's going to impact their decision-making process. It's going to impact what they do the rest of their life. And it's important, I think, for the physician, and we've been trying to bring this message home to physicians, that these individuals are often aging, and they rarely have just Alzheimer's disease as a diagnosis. They may have diabetes, they may have hypertension, they may have heart failure. The management of these other medical problems are complicated and compounded by the fact they have Alzheimer's disease. So a person managing his or her own blood sugar for the diabetes management becomes much more difficult when the person is having memory and thinking problems. So I think for all of those reasons, it's important that we implore the physicians and the medical community out there to really get up to speed on what this diagnosis takes, what it means for the individuals, and what we can do about it.
And I'll follow up. The excellent question was followed by an excellent answer, and I will not reiterate what Dr. Peterson said, but let me make a couple comments. One, about difficulty of diagnosis. Connie mentioned a doctor saying, well, this is atypical, this is not typical. The reality is that Alzheimer's and actually the whole range of dementias, it's a spectrum. And not everything is cookie cutter. It's not at all that way. Alzheimer's itself can take on many different flavors. It can involve the frontal lobe. It can involve the back of the brain. It often involves the memory, but it can involve the other areas as well. So there can be ways in which the diseases can trick us as well. So yes, in addition to this particular point, I think the fact that it's a complicated disease that's dynamic over time, changes over time, contributes also to the failure of early diagnosis. And I just wanted to say, I wanted to commend you for your comments about your mother and the points you raised about your sister's involvement. The emotional and physical toll that occurs on families is huge. And that's a dynamic process too over time, and you eloquently described that.